Okay, so Sandy and I met probably about over a year ago, and she's probably one of the strongest advocates for herself that I've ever met. The most positive patient that I've ever met, and the never ever give up phrase is the epitome of Sandy. And not only does she have that for herself, but she has that same, she encourages her physicians and the specialists to never ever give up, and also anyone that comes in contact with her. And I know not only has she inspired me, but she's inspired everyone, all her medical team that works with her. And it often speaks to, I remember, and I've mentioned this in another session, but Dr. Walsh had said a long time ago, I don't know if he remembers, but just how patients seem to survive longer when they have, when they have a positive outlook, or they have hope, they have that support from their families and their loved ones. And so I think with, all of the work that Sandy's medical team has done for her and also her outlook in life, it's created a pretty awesome individual. So I hope all of you are inspired, and this is a great way to end the National Pancreas Conference.
Okay, so thank you very much for your kind words, Stephanie. She's right. We've been friends probably for over a year now, and I'm very appreciative of all the work she's done and Craig's cause has. And I really just want to thank you all very much, all the organizers, all the sponsors that put this conference together. It is invaluable, and I look forward to future ones coming up annually. And to all your clinicians and all your staff and everything you guys do for us every day of the year. Thank you. So with that, we'll just start the presentation. So boy, Ravi and Julie, you couldn't have given me a better setup. Everything you were talking about and getting kind of a patient's perspective, hopefully I can do that for the group today. So let's start with a little bit about me. So I think I almost fit that perfect criteria for, if you're going to have pancreatic cancer, to have access to the various procedures and treatments, etc. So I'm 63 years old. I was born in March. Actually, I was born in Greece. I came to Canada when I was 3 years old with my parents. So I'm an immigrant. I was raised in Hamilton, Ontario. Then I moved to Toronto after school, started my career in banking, then went to the federal government. Couldn't do the government thing, had to go back to private sector, started a career in information technology, ended up at IBM Canada about 28 years ago, where I was in sales. And I began my career in Canada, where I had various positions. Then I went to the States. Then I had North American roles. Then I had global roles, hence the travel of the world. So as you can tell, I love constant challenges. So, but little did I know, right? So it was June of 2018, and IBM was putting together packages for old folks like me and wanting to recruit young people. So they said to me, okay, we've got a package for you. We'll give you this buyout. Just stay to the last slide, Stephanie.
Oh, sorry. Yep.
And we'll pay for your healthcare until you're 65. So I thought, well, that's a sweet deal. But I didn't know then in June of 2018 that cancer will rear its ugly head 6 months later in December of 2018. So personally, I'm single with no children. I have one sibling. I have a brother who's 7 years younger, who doted over me when I first got diagnosed, as you can well imagine. And both my parents died early at around the age of 60. So when I say all this, it's just the importance of me having to be, when you say, why are you such a strong advocate? Well, I kind of have to be, right? It's me. So, but cancer was not new to me. 12 years ago, I was diagnosed with breast cancer. I lived in Markham at the time. So then I had surgery first at the Markham Stouffville Hospital. And then my brother and sister-in-law, my sister-in-law works in the healthcare field. And she said, there's no way you're going to go through all the treatment by yourself in Markham. So I moved to Burlington at that time. So I had the surgery there. Then I had my my treatment for the breast cancer, the chemotherapy and radiation at the Juravinski Hospital. over my own personal cancer experience, I lost my mom to pancreatic cancer 30 years ago. And back then, as you guys know, it was literally, it was 4 months from diagnosis to death. And she was not offered any kind of treatments or surgeries or anything. It was basically just pain management at that time. So I was very familiar with pancreatic cancer going back years. And it didn't stop there. Her two brothers had colon cancer. And then my first cousin also died of ovarian cancer. So, and you think of all this cancer surrounding me and my family. We did get genetic testing done and everything came back negative. Everything came back negative. So I thought maybe that's a good sign. So anyways, we'll go to the next slide, please. So we talked about kind of timing and what influences how quickly you can get treatments and things like that in this past presentation. So this is a good news story. So if I go back, as I said, it was December 2018. My initial diagnosis ended up being stage 3 Pancreatic, so it wasn't stage 1 and things, right? So I'm at home, it's a Sunday, I'm experiencing upper back pain. I'm thinking to myself, well, you know what? I've had this before. It's probably just the way I'm sleeping. I'm not sleeping right. But then I got this itchiness, and it was itchiness all over, and it was brutal. And I thought, uh-oh. And then I got that darker urine, and I got those looser kind of grayer kind of stools. And that's when all the light bulbs went off. And I said, okay, this is not good. Something is wrong. So I called my GP the following morning. And keep in mind, this GP, my general practitioner, had been treating the Robis family for decades, right? So he was familiar with all our history and the history with pancreatic cancer and my breast cancer, et cetera, et cetera. So I told him all my symptoms. We had the discussion. He did kind of a quick little workover. And then initially, he thought it might be Hep C, right? And I thought, And I said, well, really? And he says, why? He said, did you go to Dr. Google? I said, well, yeah, sorry, I did. So, and I thought I had either acute or chronic pancreatitis, right? But again, I wasn't sure. So he said, anyways, we got the lab work rec. And Tuesday I went and had the lab work done at, what's the name of the place? I can't remember the big lab. Anyways, and they returned it right away. And they called my family doctor and said, this is abnormal. Something's not right here. She's going to need an ultrasound. So he called me and said, okay, so we have the ultrasound. It's scheduled for Joseph Brand Hospital, which is literally a 5-minute walk from me. So it was nice and close. That was good. And I said, okay, so when? And he said, 2 weeks. And that's when Sandy kicked in and said, I knew how insidious this disease was with my mom. And I said, I'm not waiting 2 weeks. So I went online to find clinics that did ultrasounds. And I found one that was literally 5 minutes away. And I called them. Said, is there any way you guys have any appointments? And they said, you're not going to believe this, Miss Robis, but we literally got a cancellation for 7:30 tomorrow morning. Can you come in? And I'm like, yes. So I called my GP. They faxed over the rec, had the ultrasound done. They responded in lightning speed. They said, yep, something suspicious here. You're going to need a CT scan. So in the background, both my GP and my nurse practitioner were kind of thinking, this is kind of going in this cancer direction. So they contacted the Juravinsky Hospital in Hamilton and contacted a surgeon who specialized in PC. And we needed to get a CT scan done. So he called me and said, okay, we're going to get it done on Saturday. He said, here's the plan. Come to the ER at 9 a.m. I'm on call, have them page me. We'll get this CT scan done and we'll get to the bottom of it. And that's exactly what happened. So it was very quick, had it done. He said, yeah, you look like you got like a 4-centimeter mass here, the head of your pancreas. And he said, you're also starting to turn jaundice. He said, so we're going to have to put a stent in. So that was Saturday. And then Monday, he performed the ERCP himself. And it was literally, as you know, quick in and out day surgery, painless. And I think it was only a few hours or so, no complications whatsoever. But then that validated the need. So I didn't have any formal biopsies. So then he said, well, we're going to have to do surgery, and we're going to do this surgery called the Whipple. So I had never heard of the Whipple. And he said, look, he said, it's Christmas time. It's like mid-December. He said, it's Christmas time. It's going to be, people are on vacation. It's going to be hard to find OR time. You know, you enjoy your Christmas, and we'll see you in early to mid January, and that's when we'll schedule the surgery. And that's when Sandy kicked in again and said, no, I'm not waiting. I don't want to wait. I want this surgery as soon as humanly possible. So please find the OR time. So he did. And so literally went from Monday to securing the 9 hours of time, getting the OR, getting the staff, get everything lined up. And my surgery was on the Friday. So the bottom line here is speed matters. And this went extremely quickly. So I was thrilled with that. And that obviously had to do with my very positive outcome as well. If you go to the next slide, please, Stephanie. Okay, so here's kind of all the treatments I went through. So my surgeon, Dr. Deepak Dath, when I met with him, he told me all about the Whipple. He did actually a whiteboard session where he said, here's kind of what I'm looking at right now. Here's what I think I'm going to take out. Here's how we're going to put you back together. Here's kind of and I did have a pre-op meeting as well with the anesthesiologist and the surgeon and the nurse and all that stuff. And I passed all that. So he did a very detailed discussion on what to expect. So I didn't have a lot of surprises, right? So he said, we can do the surgery first. I was not referred to medical oncology first. I went right to surgery, right? So, and I was expecting the Whipple, and he was expecting the Whipple. But once we got in there, it turned into a total. And the reason it did is because he said my pancreas was smaller than a normal pancreas, and that it was very severely calcified and atrophied. So the whole thing had to come out. So then the spleen. So I ended up having my entire pancreas removed, my spleen, my gallbladder, common bile duct, and portions of my small intestine. So it was an 8.5-hour open surgery. I was in, and no complications then and 3 years later, folks, nothing, no infections. I've never even had a single fever, no dumping syndrome, no digestive issues. Literally, it was flawless. And I said to him, if you weren't a general surgeon, I'd tell you to get into cosmetic surgery because I have no scar. It's like magically disappeared. It's amazing. You can barely see it. So I was in the ICU for 2 days. I did get an epidural. Unfortunately, it fell out in the ICU, so I was in a little extreme pain, but they hooked me up with the, I think it was Dilaudid IV. So I was there for 2 days, and the most critically important thing that a patient can do after this procedure is walk, and I mean walk, 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 walk. The next day, I was dangling my feet. I was in my recliner. I was walking around my room there. When I went to the ward, I was there for 8 days. I would literally walk every single day. Hours, right? And anyone that came to visit me, they had to go to the sunroom. We would walk from the Juravinsky Hospital to the cancer center. My appetite was starting to come back. I didn't have issues there, but because my entire pancreas is removed, I instantly became type 3C diabetic. Oh, the other thing I should add is that Dr. Dath was my primary surgeon. But once they got in, they realized I did have something, it was portal vein involvement. So they had a cardiovascular surgeon on standby. So he came in to do his thing after Dr. Dath did his. And they also paged in if you know, Michael Marcaccio. And because the whole pancreas had to come out and becoming diabetic was a big thing, they wanted to make sure they were kind of consulting in real time to make sure they were making the right decision, given I wasn't around to be able to comment on it. But I instantly became diabetic. So if you can imagine, I'm in the hospital, I'm on these, painkillers, a little dozy here and there, and I've got to learn how to be a diabetic kind of overnight, how to do the finger poking, how to administer the insulin, all those sorts of things. So, and then my digestive enzymes and my PPI, and some people think I'm nuts, but sometimes the diabetes, it's a full-time job, right? And it's more overwhelming than the cancer can be on some days. But anyway, so that was all the surgery part of it. Everything went extremely well. Went to review the pathology report 2 weeks later. And in fact, it was a 3.5 centimeter tumor. And I had 7 out of my 23 lymph nodes were positive, but I had clear margins. So that was a good thing. And I recovered well. So I was then referred to medical oncology. That's when I met Dr. Kevin Zabuk. So that was, I'm going to say 2 or 3 weeks after surgery. So we wanted the 6 weeks to recover from the surgery. And then we had, again, a very detailed conversation on the chemo regime we would do. And he said it would be FOLFIRINOX because, as you guys have talked about, it's the kind of the gold standard for advanced PC. And given I had good PS, I had no comorbidities. I didn't have any kind of I was on no medications, no obesity, no diabetes, well, diabetes before. So I was a good candidate for the chemo. And as it worked out, what Robbie was saying earlier, I was one of the ones that reacted very well. So I didn't have any of these side effects. I didn't have any nausea, vomiting, diarrhea, constipation, nothing. I mean, the meds they prescribed to me to take over, I think it was a 3-4 day period, including dexamethasone and some of the other anti-nausea meds, did the trick, right? And I didn't lose my hair. So it did kind of thin out a bit, but it didn't fall out in clumps. So that was good. So I responded very well, and I remained no evidence of disease, Ned, I don't use the word cure, for 2 years. And I was living the dream. Anytime my doctors would ask me during appointments, how you doing, Sandy? I'm like, I'm living the dream. I was shopping and carrying on with my life, and it was great. And then shortly after that, we decided to get genomic testing done as well, because I thought, and we didn't look into clinical trials up front. I really kind of regret that. But in any event, to prepare for clinical trials, I thought I need to get a sense of my tumor and what mutations I might have. So I contacted the PanCan Action Network out of the States, and I wasn't sure if they would actually handle Canadian clients, but they did, and they were lovely. The case manager called me. It was literally a 2-minute exercise for me. I signed a release form so Dr. Zabuk could provide the tissue sample to them. And 2 weeks later, he got his clinician version of the report. I got the patient version of the report. And now I knew what specific mutations I had. So I could then look at, and they also, on top of that, they also identified 3 potential clinical trials that I might be eligible for. So it was kind of a win-win there. And so that was 2 years flying, right, folks? Everything great. And then almost 2 years to the day, last December, I got recurrence with mets to my liver and my surgical bed. And so according to the CT, and so my CA19-9 had been going up. And in the CT scan, it showed what Dr. Zabuk said was tiny but many lesions in both those locations, right? So then it was like, okay, what are we going to do now? And I asked a lot of questions. I said, can you do some kind of ablation? What I wanted to know, all the options on the table beyond just chemotherapy. So I did secure a second opinion from Princess Margaret. And I had done my homework and was very aware of the Wallace McCain Cancer Center there and all the wonderful resources. And I knew that Jennifer Knox was Dr. Jennifer Knox was the lead investigator on many of these PC trials. So thankfully, my GP did talk to my med-onc, and we got the second opinion, and she concurred with him. Next slide. So we did, so so Dr. Zabuk had said to me, your body has a memory, right? We're not going to put you back on FOLFIRINOX again, because your body already knows you had that. Standard of care is Gemzar Abraxane. So that's what I went on. And just like the FOLFIRINOX did its job and kept me med for 2 years, this GA was fabulous. Like after only 8 treatments, my CA19-9 dropped from an all-time high of 619 down to 19. But more importantly, the CT scan showed that there was no visible signs of the lesions in both locations. So I was effectively NED again. Yippee, right? And I skipped the part here about a clinical trial. I have a separate slide on this because I think you're going to find this very interesting. This is not a specific trial for pancreatic cancer. It's more around COVID, and I'll explain that later in a few slides coming up. So I had all this medical treatment, the surgery, the chemotherapy, and I thought, what else can I do? I wanted to kind of take a more holistic approach here, right? So I was having things like pain and neuropathy and fatigue. And I thought, well, what natural options are there that I can try? So my nurse practitioner recommended an excellent acupuncturist that does not just acupuncture, but laser and myofascial release therapy. So I spoke to my oncologist, made sure it was cool with him. And he said, I've heard very good things. And I'll speak to that about how effective that has been for me. And life was flying high. And then all of a sudden, this was weird. So it was this past December 20th. And I was at home ready to go to my friend's cottage, had everything packed up. And I started getting chest pain. And I mean like really, really, really bad chest pain, like a 15 out of, on a 1 to 10, I was like a 15. Now, when I had the breast cancer and I had chemotherapy then, I had chest pains and I went to the ER and they identified 3 PEs in my lungs. So I thought, uh-oh, let's hope they're not blood clots again. So wanted to rule out any PEs or any heart attacks or anything like that. So off I went to the hospital, just went to Joe Brandt here. And it was about an 8-hour ordeal, but nonetheless, by the time they did the CT scan and stuff, the doctor there thought it was an esophageal spasm. And I had heard that term before from my surgeon, right? Because I thought I had a Whipple attack. He said, no, it's probably that spasm that you had. So anyway, so I let my GP know, I let my onco know, I let my surgeon know, I let them all know about this hospital visit and what this diagnosis was. And everybody disagreed. So to this day, we don't know why it happened and we don't know how to prevent it in the future. But thankfully, I haven't had that anymore. I don't know how much of the natural stuff I did helped or any, but all good so far. And to this day, I remain on GA because it's working and my side effects are minimal. As I said, it's just basically fatigue, but fatigue can be pretty severe, and the neuropathy in my fingers and toes. And there's an update to this. My CT scan actually got moved up to December 15th. So that's when we'll get confirmation that the chemo is actually still working. So, and next slide, please, Stephanie. Okay, so we talk about having hope and keeping inspiration alive, but I think having a sense of humor is also important here. So there's me. I'm going to say it was days before Christmas, so I had my Rudolph the Red-Nosed Reindeer glasses on there, and I had made a few dozen cookies for the OR staff, my homemade shortbread cookies. And literally, I'm skipping into the OR room. Can you imagine? Here I am, stage 3 PC, brutal disease, and I'm skipping in there. And my surgeon and the entire staff were like killing themselves laughing, right? But like I said, you have to have a sense of humor. So that was just an hour before. And then you look on the left, and that's me. That is December 21st. This is me, March 31st. So this is my 61st birthday. So this is just a few months after having the surgery and currently on chemo. Now I'm a little thin there, and Dr. Zabuk had said to me, listen, if you're going to do one thing during chemo, Sandy, he says, I need you to eat. And I mean eat. I can't have you starve to death, right? So eat I did. And I managed to gain all my weight back, even during chemo, even after the surgery, got back to my fighting weight within a matter of months. And I've kept it for 2 years, right? 2 years. And there's one of my dear friends of 40 years, his granddaughter made these sneakers for me. So these were my chemo shoes, right? Look at me and all this chemo and I'm still so sexy. So the patients in the chemo suite love that, but the chemo nurses, they love them anymore. So people were wanting to get order of them, but that was, again, just having fun with it. And then when chemo was done and I was ringing the bell and we have a video of this, I thought, okay, all these lovely chemo nurses, they were so kind and compassionate and they were just lovely. I thought, what am I going to do to thank them for all the wonderful care I got? And so I know a lot of people in the healthcare industry. I would say I'm pretty well connected, and that probably helped too. Many of them work at the same hospital where I was being treated. So I asked the past onco nurses and other nurses, I said, I've got to say thank you to these nurses. What do you think I should get them? And most of them said, wine. I said, I don't think I can bring wine, even though this was still for a chemo. And they said, you know what? Have you heard of that Monster Donut place in Hamilton? They love them. So my brother was the one that would take me to chemo, right? So he went, got 2 dozen of these donuts, and the nurses love them. So moral of the story, take care of those that take care of you. Next slide, please, Stephanie. Okay, so here are the docs that saved my life. And this, so Dr. Deepak Dath, as I said, was my surgeon. He was the one that I saw first. Um, and, look at his smile, right? Like he continued to stay so positive the entire time. And he knew that, I was the type that was, very aggressive. I wanted kind of the straight answer. I didn't want to wait. I wanted to move forward. I was optimistic. I wanted the whole story, all those sorts of things. And he was phenomenal, right? But when I was first referred to him, we patients, good or bad, once we get a new doctor, we instantly go to rate an MD. We want to make sure what everybody's saying about him. And of course, the comments were glowing. But as luck would have it, my friend Chris, who worked at Hamilton Health Sciences, went to high school with Dr. Dath in Sudbury and worked in endoscopy. So when I had my ERCP, it was Chris tag teaming with Dr. Dath. So I ended up having quite the relationship with him. And as I said, he's been, and he didn't cut and run. So it's been 3 years, and to this day, if I ever need to talk to him, like when I was in the ER, I wanted to kind of get his opinion. I called Kim, no problem. He called me right back. We talked about it. It was great. And thankfully, after the surgery was over, then he sent me over to Dr. Kevin Zabuk, and they obviously knew each other, and they had both specialized in pancreatic cancer. So I'm at a high volume center. I've got docs that really do this stuff for a living. When I asked him how many Whipples he had done, he said, I think something like, is it 250 or 275? And I said, good thing, doc, because if it was 25, I'd be out the door. So very skilled and experienced. And so so Chris knew Dr. Dath. And then when I got to Dr. Zabuk, it ends up his oncology nurse, specifically Jody, I knew her too. So I had two personal references of two of the most amazing clinicians I could have had. So, and again, Kevin never talked about expiry dates or any of that kind of stuff. Everything was up and up. We would talk about the various treatments, all the pros and cons. He was open to other things, like we said about acupuncture and things like that. Like I knew I wasn't supposed to take certain antioxidants. So, we were all good there. But these are the two gentlemen that helped save my life. So the next slide, please, Stephanie. And so beyond all the medical care I had, I wanted to also take a more holistic approach. And I can tell you, the care I get from my nurse practitioner, Beth Gerritsen, is unbelievable. Like unbelievable what she does for me. So when you guys told me you were preparing that e-learning module and I told her about it, she was ecstatic. So she listens to me. She makes sure all my medications, nothing falls behind. I get referrals in a timely manner. I get second opinions in a timely manner. I get access. She's the one that introduced me to Gabriel Ho, who does the acupuncture and things, right? So and then when she left the GP that I was with initially, she went to another one in Burlington, which is only 5 minutes away from me. So double bonus there. She took me with her. She said, listen, she says, I can't let you go. She said, there's no way. So, and she proactively approached palliative care. So we kind of were ahead of plan. We kind of knew what the bigger picture could look like. So she's been terrific. And she's big into technology. So she loves all this high-tech stuff and artificial intelligence and all those sorts of things. So we have that in common. So then she introduced me to Gabe. So as I said, I was having some pain, right? And it started off with kind of neck pain and back pain. And I thought, oh, I don't know what this is. So I went to him and he used the traditional Chinese medicine and he did what they call myofascial release therapy, kind of like massage, kind of more targeted and more intense. And right after the treatment, the pain went away. I thought, wow, that's pretty magical. So then after that, with the chemo, I started to get joint pain, right? So it started in my ankles and it would manifest up my shin and into my knee joints, right? And I thought, well, maybe this will help with that too. So what did he do? He did the acupuncture. And I think he did some laser and lo and behold, it was gone. And then few months later, I fell at home, not an old lady fall, guys, but I had brand new slippers with new treads. So I fell and all the weight went on my left knee. So it was inflamed like the size of a grapefruit and bruised and so painful. It was unbelievable. So I went to see Gabe the next day there, and he did, in that particular case, he did about 5 or 6 minutes of laser. And he did a before and after picture. And it literally, you could just see it shrinking and shrinking and shrinking. And within 2 days, the pain was gone, the inflammation was gone, and the bruising was gone. Again, I'm thinking magic once again. And then just a few months ago, I started to have pain when I would eat. And I've never had pain while eating. And I also had some pain in my surgical bed where some of those lesions were, right? So I thought, oh, I hope it's not the cancer. I don't think it is. So, Gabe, can you see me? And there he did the myofascial, and he did what they call Japanese acupuncture. So it's like little round bandages of the size of my little baby finger here. And they're little needles, just like my diabetic sensor. And they put one in each of my ankles, one in my wrist, and then one in my left leg, which is supposed to correlate with my stomach for pain there. And this was like 9:30 in the morning. So I went home and I made lunch, no pain. Made dinner, no pain. The next day, made lunch, made dinner, gone again. So I'm thinking, now I know these kind of treatments don't work for everybody, folks, but I can tell you for me, they're extremely effective. So those are two more folks of my Team Sandy there. Next slide, please. Okay, so this is the clinical trial that I was telling you about. So how this all started was I was at chemo at the Juravinsky, kind of in the waiting room, and there was a flyer on the wall, and I thought I'll look at it, and this is before the COVID vaccine was out, right? So I'm reading about it. I'm thinking, well, this is really interesting. The last thing I want is to get sick and not be able to continue chemo. And if this is going to prevent, as it says there, severe symptoms like respiratory issues or infection, et cetera, I would be interested. So I took a picture of it and provided a copy to my GP and provided a copy to my medical oncologist, to Dr. Zabuk, and said, like, what do you think? Right? And he goes, oh, I'll get back to you. So in standard Sandy fashion, I have to do my research. So I go to PubMed and ask, I go everywhere I can. I look at the clinicaltrials.gov site. Sure enough, it's a real trial. It was done with the intention of recruiting 1,500 patients in Canada, those with cancer. But when I looked at the other additional research, it works out of all the cancers where this drug has been used, it was most effective with pancreatic cancer and with Mets and in the liver. And I thought, okay, this is too much of a coincidence, right? So we ended up having the vaccines. There were 3 vaccines. And the lead investigator, medical oncologist, Dr. Jurgens, worked with Dr. Zabuk, so they knew each other very well. So they were both on board with this. And you fast forward now, how many months? And we don't know, guys. We don't know how much that had to do with my successful outcomes. Like Dr. Zabuk said, like, we just won't know. And Dr. Jurgens basically said, look, the purpose of this trial was not for pancreatic cancer, right? It was to prevent COVID symptoms. So that's not what's being studied. So then I thought, well, somebody can study me. So I thought, who could study me? And it ends up the manufacturer of the drug is in the UK, I believe, and they're going to run some more trials. So otherwise, the only thing is, I don't know if it had anything to do with it, like I said, but if it can help just one more person, then I'm happy to be a guinea pig for anybody. So that was that particular trial. Next slide, please. Okay, so we talked about the role of advocacy. So I'm a very strong self-advocate, but I also help others advocate for them, and caregivers and patients alike, right? So, and I think this is really, as I say here, quite a selfish act, because I think I get more out of it than they get. So I had worked with various pancreatic cancer charities, many of them, all the common ones, including Craig's Cause, and had told my story publicly. So I had done articles, I did a PSA, I did a podcast, And so my name was out there, and I got lots of friend requests on Facebook to kind of hear about this wonderful story of mine. And so through that, I ended up meeting quite a few survivors, and they vary from around the world. So, between Tina in Australia and Sear's mother, who's 85 in The Hague, to there's James in Chicago, to, I mean, from around the world. But I try to stay focused on Canada. So there's quite a few people, and I don't give them medical advice, obviously, right? But it's, as Stephanie was saying, it's give them that never give up attitude so they can keep fighting. And I can tell you, the spouses of these people or the brothers and relatives have personally called me after and said, after that Zoom meeting, my brother is so psyched. He actually told me he's excited about starting chemo. So, and I really think it's kind of a 360, right? What I give, I get back tenfold. And this is why I don't know how we can get some kind of a buddy system going. And actually, Dr. Dath, my surgeon, kind of, tried it out. So he had a patient who had her entire pancreas removed. So kind of in a similar situation. And she was older and she was quite nervous. And so he's at her bedside about to discharge her. And he calls me. So he's like, hey, Sandy, it's Dr. Dath. I'm like, how are you, Dr. Dath? He goes, good. He said, listen, I got a favor to ask you. He said, I've got a patient here who I think is going to need some Sandy uplifting, some little hope and inspiration to kind of help her through this. Would you mind? I said, no, not at all. So we exchanged the numbers, and she was an older Czechoslovakian woman. And it ended up her son was here from Czechoslovakia for the surgery. So I went over to their place, and me being Greek and her being Czechoslovakian, I made them a huge tray of my stuffed peppers. And we went through kind of, I was like a year, I would say about a year ahead of her. So she had tons of questions on what to expect in terms of the recovery, the digestive issues, the diabetes, et cetera, et cetera. So that was one, and I've done that a few times with some folks that I've met close by. And like I said, it makes me feel so good. And then speaking up is important. So, and people listen. I remember once I was in the chemo suite, and it was the end of the day, and there was only I think one nurse left and the manager, and they missed one of my meds to give me. And so obviously I said, hey guys, I missed this med, and it was closer to 5 o'clock. And so the manager did speak to me, and she took me very seriously. The next morning, she took my cell number. The next morning, 8:30, she called me. She said, that shouldn't have happened. And I said, what I would like to see happen is, for FOLFIRINOX is a 6-hour infusion, right? I shouldn't start, any time after 10 o'clock. So from then on, my chemo never stopped after 10 o'clock. So I didn't have to go into that end of day type of time frame, right? So, and I asked a lot of questions. I try to listen carefully. I document everything. I've got journals. And I asked for all options. So I want to know right up front. So is it going to be surgery? Is it going to be chemo? What kind of chemo? Is it going to be even a candidate for radiation? Am I a candidate for immunotherapy? Am I a candidate for any clinical trials? I also had help from home care, I might add. So they were fabulous. And I do my research, and I only go to evidence-based, peer-reviewed. PubMed is my friend, ASCO is my friend, so that's where I go for my research, as well as obviously the various pancreatic cancer charities as well. I find extremely helpful. Next slide, Stephanie, please. Hey, so here's to the meat of it. So where do I put all this hope, you might ask? So, as I say, hope is an equal opportunity resource, right? Everybody has access to hope, and hope and optimism are very closely tied, right? But hope is hope, but you have to take action, right? I had goals set that I wanted to be, it was like kind of mind over matter, right? I wanted to psych myself out that this chemo wasn't going to bug me. And, after I'd come home from chemo, I was staying at my brother's, I would do my little chemo happy dance, and they thought I was nuts. And, I'd be out shopping in the malls and I'd have my chemo pump around me. Oh, I also had IV hydration during chemo, and that really helped. So here I'm all double bagged here. I've got the little, I just must have looked hilarious, but you know what? I really didn't care. I just wanted to continue to live life and as normal as humanly possible, right? So I had all that motivation. I took action immediately. And like they say, it takes a village, right? So my brother and sister-in-law, of course, were extremely loving and helpful. My brother would take me to chemo all the time. And I tell you, having cancer has its benefits. Whatever I wanted, I got. I'd be at chemo and I'd say, I'm sure if I said I wanted steak and lobster, George would have got me steak and lobster. And all my family and friends would bring over all my favorite foods. And if I wanted this or wanted that, I must say I was pretty spoiled rotten. But it's that optimism, it's contagious, right? So the more optimistic I was, I'd send out my blasts about how my something little, that I would celebrate, even if my CA 19.9 stayed in range. And I'd be like, yippee, double yippee, my CA 19.9 is, 24, da, 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 da. And then it just became contagious. And the same with my medical team, right? The more optimistic I was, the more optimistic there was. I was never given expiration dates. I was never said, I can't do this, I can't do this, right? So it was my whole ecosystem, if you will. We were all on the same page, all full of, inspiration and confidence and knew we could get things done. And as I say here, I relied on my past successes, right? So I knew I had beat chemo before, and I knew I had done this before. I thought, you know what, I can do it. Trust your judgment. You can't not trust yourself, right? And obviously your family and faith and these little successes. I tell you, when I drive myself down to chemo, if I get a free parking spot, woohoo, this is a good day. That's a little success. If I find my favorite fruit watermelon is on sale for, I'm like, woohoo, this is a good day. So all those little successes kind of keep me happy and kind of, living more of this normal life. So next slide. And this is my final slide here. Stephanie, please. Okay, sense of humor. This is critical. I know this kind of sounds a little silly that you'd have someone now with stage 4 pancreatic cancer who humor is such a vital role. In fact, when I was doing a story with one of the charities, that the writer had said to me, I kept laughing and we were joking. She said to me, she said, I don't want to upset you. She says, but why do you laugh so much? Why are you so happy? And then she said, she thought to herself, you know what? We need to do a story on like humor and cancer. So she contacted her director and ends up, they said, yeah, we want to do kind of an article around therapeutic laughter and cancer and the role it plays. So together with a medical oncologist from the Cleveland Clinic in the States, we were both quoted in this article, and everybody loved it. And I've done practical jokes for Halloween. For 2 years in a row, I was Ruth Bader Ginsburg, my hero, rest in peace. And then I thought, for this year, what am I going to do? And I thought, well, it takes a multidisciplinary team, right? And you think about all a patient has to juggle. So you've got medical oncology, you've got surgery, you've got the diabetes side of it, you've got the natural side of it, you've got like all these different resources and different treatments and medications, and you really need to be the quarterback of your team. This is my team, right? I need to lead my team. So who was I this year for Halloween, guys? Tom Brady. And the kids loved it, and actually they could all relate. So humor is extremely important. And as I said earlier, I'm kind of a big picture person. I want to know all my options. Now, unfortunately, Cancer Care Ontario doesn't have a quote unquote pancreatic cancer patient pathway, but I noticed I saw that flow chart that was done in Alberta. I'm really impressed with that. So I just think the more choices we have and the more information we have, the more informed decisions we can make. That was referenced in the past presentation as well. But, this is not all that easy. I mean, I'm an up person, but, sometimes you have your rough days, and, you have to expect a few obstacles along the way. So once you set expectations, then you're fine. And And then, and just finally here, you have to create new dreams. So, as I said, I traveled the world with IBM, but one place I had not been on, and where I'm planning to go once COVID is finally under control in Europe, is San Sebastian. So have you guys heard of San Sebastian? So Anthony Bourdain went there. And it's in Basque country, right by Spain, close to France. And it's one of the foodie capitals of the world. As you've learned, I'm a big foodie, and beautiful architecture, beautiful culture. So that's where I'm heading once COVID is safe enough to do so. And check this out. So how am I going to learn about this place? So it ends up, one of my online buddies in Facebook, who's a Whipple warrior, stage 3 Pancreatic as well. So similar diagnosis, similar treatment plan. What does he do? He lives in San Sebastian and he owns his own little tour company. So I have a personal tour guide, Michael, for when I go. How you talk about karma, right? How that kind of comes around. So I'm very much looking forward to that. And that's my next step next year in my journey. So I think that's the end of it there, Stephanie, right? Oh, no, I've got some closing thoughts. Sorry. Okay, so we talked about this, and you guys also talked about this earlier. So open communication and information sharing is critical. We know, unfortunately, there are silos. There are silos within specific groups. There are silos within departments. There are silos within hospitals. There are silos within provinces. There are silos across the country. There are all types of silos that exist. So, this is why I'm adamant about keeping my Tom Brady hat on, to make sure that there's open communication, good, bad, and ugly about everything, all the information sharing. I love having my portal with my GP. I love having the portal with the hospital for all my information being posted there as well. So that's critically important. And then listen to your body. Had I not listened to my body and sloughed all that stuff off, right, all those symptoms I had, I would not be in the place I am today, right? So speed is critical, incredibly critical. And then, as I said earlier, celebrate those big wins and the small wins. Even that parking spot will put a smile on your face. And make sure you keep a journal of everything, so you can document all the findings, everything that you've heard. So again, you can make better decisions. And as I always say, keep advocating, keep hope alive, and as we say in the biz, never ever give up. So thank you.